On average, 5 people a week die as a result of domestic abuse in this country. And actually now there's more suicides related to domestic abuse than actual homicides. And behind each of these statistics, each 5 people a week, this is a life lost and also a family devastated. And in far too many cases, Chair, there has been repeated contact with health services, and there's been moments when the health service could have intervened. So the NHS is actually the most consistent point of contact for people living with abuse, and about 500,000 people seek support from the NHS each year in relation to domestic abuse. And 85% of them ask at least 5 times before they receive effective support. If we are serious about preventing domestic abuse, then we must be serious about the role of the NHS, not just in primary care, but across all mental health services, across maternity, and through emergency departments and through community care. So it has to go right across the NHS, not just in primary care. So I really welcome this government supporting victims with the largest ever investment of £550 million in victim support over the next 3 years, and an additional £5 million each year from the Department of Health and Social Care. One of the things that I teach other GPs in training is that there's something called a hidden agenda. Women particularly will present to the GP, but they won't say that they're being abused. They will have other symptoms, and we must recognise that presentation straight away. For example, health visitors are in an ideal situation to hear this type of thing and must be aware of this potentiality. In A&E, it's also very common that women present, and often women present with overdose, and underneath that there's domestic abuse. Midwives often presented with this, and obviously mental health workers, even gynecology services, this is often behind that type of thing, and social services as well. So often women will present to health service with different symptoms, but this really is a cry for help, and we must recognise that. So what do we need to do to really support these women? Now, one of the things I'm really delighted about is this concept of steps to safety. The Department of Health and Social Care will roll out a domestic abuse and sexual violence referral service across integrated care boards, and it will give GPs the tools and ability to identify and refer victims and survivors into support. Now, what's really important about this, it's a simple service with one number, because if it's not simple, then it won't be used by health services, and that's incredibly important. And it's also important that we make use of existing resources. I visited the Sexual Abuse Resource Centre at Gloucester Royal Hospital recently. It's a fantastic resource with really well-trained staff, and they're available 24/7 as well. So if we're really serious about preventing domestic abuse and the death that so often follow it, then the NHS must be properly equipped to play its full role. And there are 3 points I'd like to make. It's firstly about this funding, and this is around training and about investing in services that will really help in domestic abuse. And as I say, these steps to safety are key, because it must be simple for women to access this service. And it's also really important that wherever a woman presents to the NHS, that person is trained to detect that domestic abuse and is aware of what's available for that woman. And finally, we must have a comprehensive whole health plan for the NHS and for tackling domestic abuse and violence against women and girls. And this must cover primary care, mental health, maternity, accident and emergency service. And I'd like it to be published by 2027 at the latest. I'd like to just conclude then, is that if we get those 3 things right, around the funding and about recognition and about a comprehensive and integrated care service, that we can move forward to a service that repeatedly sees and recognises abuse and immediately steps in to stop it. So that's the shift that this debate is calling for, and it's one that could save many lives. Thank you.